Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Wednesday, April 21st. I'll now turn things over to Dr. Fitzgerald for today's update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us. Since the media advisory yesterday, we have one new confirmed case of COVID-19 in our province in the Eastern Health Region. The individual is between the ages of 50 and 59 and is a travel-related case. The total number of cases in our province is 1,049. There has been one new recovery, leaving 27 active cases in the province, and a total of 130,441 people have been tested to date. While our active case counts continue to grow, all cases are the result of travel or close contacts of known cases, and this is what we would expect to see given the epidemiology of COVID-19 across the country right now. Nationally, the third wave has reached a record high with 60,759 new cases reported in the past week, which is an increase of 7.3% compared to the previous week. In terms of COVID suppression, our province has done remarkably well, but we know that that can change quickly. Given the increase in variants and what we are seeing across the country, the risk of another outbreak in our province is real and it is significant. So we need to use every tool at our disposal to protect as many people as quickly as possible. To date, we have administered approximately 138,000 doses of vaccine, and in addition to those over 65, regional health authorities have started vaccinations for dentists and dental staff, congregate living settings, and those who are clinically vulnerable. Starting Monday, April 26th, regional health authorities will do an open call for rotational workers, truck drivers who travel outside the province, and air crew to book vaccination appointments. Labrador-Grenfell Health have already begun these vaccinations. Rotational workers and other people who travel for work comprise over a third of our travel declarations completed when entering the province. They are amongst the most frequent travelers by nature of their work, and we know that importation of the virus is our greatest risk. We anticipate that we will be able to issue an open call to the remainder of Phase 2 priority groups no later than May 14th. As a reminder, anyone who has been vaccinated is still required to adhere to public health measures, including self-isolation requirements at this time. Being vaccinated with one dose protects you from severe illness as a result of COVID-19, and we are still evaluating the evidence on vaccines and transmission of COVID. We still have a large proportion of our population that is unvaccinated and unprotected. We must keep our risk of exposure low while we continue to build our population's immunity. Even when vaccinated, rotational workers availing of modified self-isolation for now will be required to test at the 3 intervals outlined in that policy. Failing to take the third test between days 11 and 13 of self-isolation is a breach of the Special Measures Order under the Public Health Protection and Promotion Act. Across Canada, the highest proportion of cases that we're seeing are among those under 30. And there are several contributing factors for this. This age group is more likely to work in places where physical distancing is more challenging, and they are exposed to more contacts in multiple bubbles between family and roommates and work. And they are more likely to participate in gatherings than other groups. And despite what my hair and wrinkles say and what my kids might say, I remember very clearly what it was like to be young. So I understand how important it is for you to be with your friends and that feeling of being invincible. And I definitely empathize with the feeling that this pandemic seems never ending. I assure you one day this will be behind us, but for now we need your help. We need you to control the controllable. Now is not the time for parties. When you do spend time with others, please do it in a way that reduces the risk to yourself, your family, and your friends. Choose a small, consistent group of friends to spend time with. Choose places that are less risky, such as outdoor activities. Socialize with a small group of 5 to 6 close friends in your own home, ensuring physical distancing. Don't share food or drinks. Say goodbye for now to the bowl of chips or plate of nachos. Choose individual meals and snacks either prepared by one person or ordered in. If you go to restaurants and bars, be sure you can distance yourself from others outside your group. If you do interact with others outside of your usual contacts in public places, Please wear a mask and maintain physical distancing. And keep track of your contacts and download the COVID Alert app. I'm always in awe at the determination and influence that our youth possess. You play a critical role in creating a better world. One day when this pandemic is in the past, I know you will want to look back and say that you did your part. I'm also asking for help from parents. Please stay connected with your children, and please discuss the importance of avoiding large-scale social gatherings. This impacts you, it impacts your family, and it impacts our province. It is critical that we avoid another large-scale outbreak like we recently had, while we work to vaccinate as many people as we can. As a recap for those who may have just joined us, we have one new case since yesterday's media advisory, and the total number of cases in the province is 1,049. And although we are making great strides in COVID suppression and in vaccinations, our work is not yet complete. So we must continue to forge ahead with the same diligence, commitment, and resolution we have shown over this past year. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I want to begin my remarks today by thanking a very special group of healthcare workers. I am, of course, speaking about those who have raised their hands at this time to help our friends and family in Ontario. You'd be hard-pressed to find a single person listening or watching this broadcast today who doesn't have a family member or close friend living in Ontario. They are going through a tough time. It's very stressful, and they need our help. For many, it will come as no surprise that frontline workers from this province are willing to make this sacrifice. But it's worth noting it here again today and publicly thanking them on behalf of all Newfoundland and Labrador for what they're about to do. There's no doubt in anyone's mind that COVID-19 has presented significant challenges, but in many cases, it has brought out the best in people. That's just who we are as Newfoundlanders and Labradorians. As I was thinking about those who are volunteering, I realized that every person in this province has played a critical role in protecting each other from the spread of this virus. By adjusting the way we live, something as simple as wearing a mask, for example, you are doing your part. We have led the way with tight restrictions from the beginning, like border controls and mandatory masks. And now, as we close in on 140,000 people being vaccinated, we continue to see that bright hope. That's how I look at this, that we'll come out the other side of this better and stronger, and we're almost there, but we're not quite there yet. With that, I'll turn it over to Dr. Haggie for some brief remarks.
Thank you very much, Premier. Before I start my comments today, I'd just like to mention and pay tribute and thank a colleague and a pillar of the Newfoundland and Labrador medical establishment, Dr. Val Conway, who passed away recently. Val came to this province back in 1974 and worked as a family doc down in Mozambique and English Harbour before going and doing his ophthalmology training and coming back to St. John's to provide specialist services. I send my condolences and our condolences to his family, and with thanks for a long period of hard work for the people of this province. We do have a steady trickle of cases, principally from travel, and we're now back to 27 active cases. On the positive side, Dr. Fitzgerald has gone into some detail about the proposals for vaccine delivery. As of last night, we have 31% of our eligible population vaccinated with at least one dose. We have delivered, as of last night, 80% of the vaccine that has been supplied to us. The remainder of that is essentially the rest of this week's supply. There will be a dip this week in our vaccine deliveries as we're expecting only 14,000 doses from Pfizer. But in the weeks after that, our baseline will go up to well over 30,000 per week. And we will continue to match those deliveries by ramping up the size and number and location of our vaccine clinics. Again, thinking of an open call for all of those in phase 2 as early as the 14th of May. In the meantime, as Dr. Fitzgerald has emphasised, we need to concentrate on our public health measures. As the Premier referenced, these have been strict from the outset. But it is interesting now that other jurisdictions are following suit with travel restrictions, which we have had for over a year. So Nova Scotia has moved in that direction, although Newfoundlanders and Labradorians are exempted because of our low numbers. British Columbia has started doing it, and Ontario has set up checkpoints between Manitoba and Quebec to try and slow the flow of cross-border traffic. On a personal level, we continue to have to do what Dr. Fitzgerald has always said, which is keep your distance, wear your mask, wash your hands, and simply hold fast as we've done before. So with that, Premier, I'll turn it back to yourself.
Well, thank you, Minister. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 4 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
I want to ask about, you mentioned, for example, dentists and those clinically vulnerable are now starting to get vaccinated. We haven't seen any sort of open calls from the health authorities. So if people feel that they fit into that group, what should they be doing in order to make sure that they're able to get a vaccine now that those people are eligible?
So what's been happening with dental staff, certainly we've been or the health authorities have been reaching out through the associations to get that information out there, and that's being communicated that way. And with clinically extremely vulnerable, again, the health authorities are working through those groups, and many of them have connections with the health authorities, and so they are reaching out and working through those groups as they are recognized within the health authorities themselves. So there are some processes in place right now for a reach out as opposed to a call in.
And I've heard of surgeries, for example, that have been canceled because of a lack of nurses. Other nurses, for example, have to work overtime because they're short-staffed. So how are we able to send healthcare professionals to Ontario when we still seem to have shortages in this province?
Peters, I'm sure you can appreciate there are different staffing levels and different staff for different units. So we are looking at all the staffing available, but we've been assured that this won't disrupt any surgeries or any clinical services at this point. There are some redundancies and people using their vacation time and otherwise that we are intending to employ at this time.
Thanks.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Minister Haggie, before you noted by April 23rd that those who are 70 and older would be vaccinated. Are we still on track to meet that deadline or that target date?
As far as I'm aware, Kellyanne, the answer is yes, we are.
All right, thank you. And in terms of the open call now that'll be happening beginning on April 26th for rotational workers, air crews, and truck drivers, why this group specifically, knowing that a lot of people are worried about children going back to school and the risk teachers are taking?
So we know that our biggest risk for disease, for outbreak, is due to importation. And the only way that importation gets here is through travel. So these are people who, by the very nature of their work, and through no fault of their own, have to travel to do their jobs. And so, we feel that on the whole, for the protection of the population, it is actually certainly quite indicated at this point that we would vaccinate those people who are at highest risk for importing the disease. I think we only have to see what's going on elsewhere in the country to realize that the risk is going up every day. So, we want to be able to protect as many people as possible, and certainly, the information that we have right now with regards to epidemiology, we've consulted with modeling about it as well, that the biggest impact we can make right now in reducing the number of infections in this province is to vaccinate this group.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. I'm still on the topic of the healthcare workers that we are sending to Ontario who have volunteered. How many healthcare workers are we sending, and when will they be leaving?
We're still looking at the exact numbers, Richard, and we're hopeful to have some more certainty around that in the next 24 hours or so. It won't be, as we've mentioned, won't be a large number, but we also know that small numbers can have a big impact. So, and we're looking at perhaps the earliest would be early next week.
And these healthcare workers, they're going to be heading into a vastly different high-stress environment in Ontario, much different from our situation here. What support can we offer these workers as they're heading over to help out?
Yeah, you're certainly right. They'll be seeing a different side of their medical practice. But as everyone on this panel knows, we have some of the best, if not the best, medical practitioners across the country right here in Newfoundland and Labrador. And I'm sure that everyone, every Newfoundlander and Labradorian, be very proud of the effort that they are going to put forward in helping people from Ontario. And having done relief effort similar to this, not the exact same in the past, just the words of encouragement and from people around the province can be quite uplifting and encouraging to people undertaking this effort, putting themselves at risk to help their brothers and sisters in Ontario. And I think this is all an effort that we should be proud of, but the showing of social support, letters of encouragement, acts of kindness, they all go a long way when undertaking an effort like this.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
The dentists have been telling us, have been rather incredulous about the fact that their work that exposes them directly to a person's open mouth still did not qualify them for phase 1 frontline priority in terms of vaccinations. Why was that?
So it depends on exposure. I mean, certainly there was screening that happened before people went to the dentist. During the times of highest transmission here in the province, our offices generally weren't open except for emergencies. And, you know, at that point, we had very little vaccine to go around. And we really needed it to be those who had highest risk for severe disease and those who were on the front line of COVID care to maintain that capacity. So that's why the people who were in phase 1 were in phase 1.
Okay. Is there an approximate percentage of frontline health workers, especially those heading to Ontario, who would have already received a second dose of vaccine?
My understanding is that one of the prerequisites, in actual fact, in our discussions were that people were fully vaccinated. By the nature of the skill set that certainly was expressed to us originally, the people who would be going from within the public health system, as it were, would be people who had been regarded as phase 1 staff. And certainly that was our understanding that was partly a prerequisite. So I can't speak directly to what the vaccine status of some of the privately employed nurses might be, but certainly my understanding is that those who have volunteered and will be going from the public system will be doubly vaccinated.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
For folks who are going through cancer treatment and have been told by their doctor, for example, that they shouldn't be going to a public clinic in a mall because the risk is too high, are there plans, for example, to give those doses to the clinics that are already doing their chemotherapy, or if it's someone who has diabetes, it might, dialysis, and administer the vaccine that way?
clinically vulnerable, I suppose?
That's a very good question. Certainly for those groups who receive facility-based care, my understanding is that, for example, dialysis and chemotherapy being the two principal examples, these individuals will be offered vaccine at the time they attend for their regular scheduled visit to whatever facility it is. So more than likely in St. John's, the dialysis patients would receive it through the kidney centre, and the chemotherapy patients through whichever facility was providing their chemotherapy.
Other provinces are lowering the age that people can get AstraZeneca down to 40. Why haven't we made a similar move?
Probably best for you to, yeah.
So we're waiting for NACI to come out with their statement on their recommendations. We have always relied on NACI to provide our guidance, and certainly we do, we do take into account what their recommendations are in our vaccine program. So we'll be waiting for that statement. When it comes out, we'll make our decisions about what we're going to do. But for right now, we're keeping it as it is, age 55 to 64.
Thanks.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. With the open call being made for rotational workers, truck drivers, and air crews as of April 26th, how will this work for those that may be in isolation in the time frame when they could be vaccinated? Are they allowed to go to vaccination clinics while in isolation?
So it's my understanding that the regional health authorities will be working through processes that can happen. And so if it's possible for a worker to wait until after their isolation period, then obviously that's the best option. But if not, then the regional health authorities are working through ways that they will be able to do that, and I'm sure the workers will be informed of that when they get their appointments.
Thank you. And as we now move further through phase 2 of vaccinations, looking to reduce the importation of disease by as much as possible, what threshold do we need to meet for high school students to go back to school full time?
So I don't know that we've actually sat down and really tried to calculate that percentage. What we do know is that right now what one dose of a vaccine will do is prevent you from getting severe disease. That's what it's been successful. It's been shown to be protective against severe disease and hospitalization. We are still studying the effect of one dose on transmission. And so, those answers just aren't really there at this point. So I think it would be really unwise for me to give a number at this point to really inform that, because I just don't think it's there.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
We're hearing there isn't enough supply to allow doctors and pharmacists to administer the vaccine, at least for the first shot. What is the situation there, and when can we expect physicians and pharmacists to start vaccinating the public?
Minister?
A good question. My understanding of the vaccine delivery schedule is that we will be getting a really significant boost to our supply towards the back end of May. At that point, that would be the time when we would look to find support from our pharmacy colleagues and from practitioners who wish to vaccinate. So it would certainly be for phase 3, but it may even come a little bit earlier, depending on when this large shipment of possibly over 200,000 doses arrives. So sometime towards the end of May.
Okay, and have we been guaranteed enough supply to ensure that the first vaccine doesn't lose its effectiveness before the second shot is available?
Again, if you look at the schedule, Pfizer have become extremely good. You can almost set your watch by their deliveries. They alone will provide us probably with enough to be able to meet the requirements of first and second shot within that 4-month window. We, in addition, are hoping that Moderna will get things straightened out as they will then become the next supplier. And obviously, depending on what happens with NACI and recommendations about AstraZeneca, we don't foresee vaccine supply as an issue going forward.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
I've heard of one incident of this happening, and it might just be an anomaly. But have there been many cases of workers or others returning to the province and giving a wrong number for follow-up when they go into isolation?
Sorry, so it was a wrong telephone number, so we can't contact
Yeah.
them? Yeah,
The wrong telephone number, yeah.
I haven't heard of that, but Minister, have you heard of any incident?
No, I do know that we have had challenges with telephone numbers with people not answering because they don't recognize where the call originates from, and this is a useful opportunity to repeat that if you are waiting for a call from a regional health authority or from public health about surveillance during quarantine, for heaven's sake, please answer your telephone. I haven't been made aware of anything other than maybe an accidental occasion where that has happened. If you were trying to suggest that was somehow a deliberate thing, I really am not aware of that.
Okay. And I'm wondering whether there's been any added pressure since last week to consider distributing vaccines to Ontario or other hard-hit areas.
Peter, frankly, in chatting with the other premiers, that's not something that has been accelerated in terms of pressure. We all made our plans with a per capita basis, and that's all what we intend to stick with at this particular moment, certainly from any premiers that I've chatted with.
Okay, thank you.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
Yes, and this is about uptake of the vaccine. Now that we're sort of winding down with the last of the over 70s to get their shot, what percentage of this age group has come forward and either booked appointments or gotten their shot?
We're gathering that data as we go, Peter. The only thing I can say is anecdotally, by and large, every clinic has been subscribed fully, and I do know there have been occasions where people have sort of hung around on the hope that someone didn't turn up, and they've been turned away at the end of the clinic and had to come back on another occasion. So I'm not hearing that uptake is an issue. We have had some clinics that were a little undersubscribed in very small communities, but by and large, I think our uptake has been way better than we had hoped for, and certainly talking to colleagues across the country, they seem to have more of a problem with no-shows than we do.
Thanks.
Kellyanne Roberts with NTV, do you have a final question?
Yes, Minister Haggie, moments ago there you noted that the timeline for Pfizer was going to increase in terms of doses being received to the province, and noting that it could be within the 4 months that people are receiving their second dose. Is it looking like the eligible population will have received their first dose well before Canada Day?
I have got a cloudy crystal ball, Kellyanne, but essentially I think we're still on track. I'll stick with the original date at the moment. It's only one shipment hitch away from a problem, so I'm not going to lay myself open to over-promising and under-delivering.
Thank you.
Richard Duggan with VOCM, do you have a final question?
Yes, a question from a listener. Canadian rotational workers can avail of a couple of tests once after they arrive in the province that can slightly modify their isolation. But international workers have to isolate for the full 14 days. This listener argues that if an international worker receives their negative COVID test within the 72 hours before they board the plane to get into Canada, why can't they avail of the same testing as Canadian workers when they get into this province?
So the international rotational workers, with regard to the isolation, so the isolation and the testing are separate things, especially at the federal level. So the OIC that requires isolation or quarantine for international travelers is still in effect. There are some international rotational workers who don't have to stay in the isolation hotels, so to speak, in one of the three major cities where people come into the country. And so they may be exempt from that and be able to travel on to their final destination. But for most of them, the exemption for isolation is still the requirement for quarantine is still in place under the federal order in council. So that's out of our jurisdiction. Certainly, the testing process is a different issue altogether from a federal point of view. Some of those rotational workers don't have to get the testing done as well once they get here in the country. But the quarantine is separate from all of that and is still required in the majority of cases.
Thank you.
Peter Jackson with the Telegram. Do you have a final question?
Yeah, I have a bit of a follow-up to that question, and that is, my understanding is that anyone traveling internationally now has a 3-day quarantine stay in the central city. In which case, are you surprised that we are still seeing international travel cases here, given that they would have had a test before they came and delayed their arrival to this province?
No, the incubation period of this virus is 14 days. So, they may have been exposed at some point prior and that initial 72-hour test tested negative. We have seen quite a number of people who have not had a positive test until the second half of the incubation period. So it's not unusual, it's not unexpected that you would perhaps have somebody who tested negative at those first 2 tests. The other thing to think about is that travel in and of itself is a risk factor for contracting this virus, and we have had a few instances here where we do feel that the travel itself was likely the source of the infection and not so much where the person was before the travel. There are lots of reasons why people can turn positive after they've had previous negative tests and after they arrive here.
Thank you, everyone. Premier, do you have any final comments for today?
Thank you all for joining us today for the COVID briefing. I'd like to thank, in particular, the hardworking people on the front lines of the immunization clinics, the regional health authorities. We're doing very well, with over 30% of the eligible population vaccinated with at least 1 dose. This is all something we should be very proud of, but we couldn't do this without the logistical support of the regional health authorities and all the hardworking women and men on the front lines who are administering these critical doses. And to the general public, please be patient, but when you're requesting your vaccine. But if we've seen anything, it should be that the system works, the science works, so be patient and let it work for you as well. So stay safe, and thanks for joining today.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.